This is it, the final message every full mouth dental implant patient needs to hear. This is a terminal treatment where your natural teeth are gone forever. And if you get it wrong the first time, redoing it is like rebuilding a house from scratch with half the materials. Today, our prosthodontists at North Texas Dental Surgery are delivering their most important takeaway messages for full mouth dental implant patients. You'll discover why there's no one-size-fits-all treatment despite what marketing claims, how to avoid getting pigeonholed into specific procedures, and why you must be your own advocate in researching every option, because bone is a commodity you can't get back. And stay tuned for the sobering reality that failed full mouth implant revisions can be 3 to 5 times harder and more expensive than the original procedure. Why you should run away from any practice that only offers one type of solution, and the crucial difference between giving treatment options to the patient versus forcing the patient into predetermined treatment. This comprehensive guide could be the difference between full mouth dental implant success and a lifelong nightmare. Could you give the patients out there, prospective patients or current patients, kind of like a takeaway message in regards to like our conversations about prosthetics for All on 4?
I think the takeaway for patients is that obviously, number one thing is that a blanket treatment for everyone is, I don't think that's possible. Like prescribing one treatment to everyone and thinking the outcome will be good long term is not the way to go. I think we have to assess the patient properly and then decide what the patient should get. More importantly, I think it's also important to gauge the expectations and kind of bring them in line with what you can deliver, right? Because I think a lot of times patients want something, but they don't really want it. Like the time the patient came to you for veneers, they didn't need veneers at all. But like we said, there will always be someone who is willing to kind of do that treatment, even though it's not warranted long term. So I think being smart and researching what you're going in for is also very important. And it doesn't matter. I think it actually does matter who you go to, because like if I am building a house, I want an experienced interior designer, a general contractor. And I don't want someone who's not trained in that. So I think that would be my takeaway. That make sure you research whoever you hire for your work, because I think that training and looking at the bigger picture matters in the treatment.
Yeah, I mean, I think the most important message is for patients to understand that an all on 4 and all on 6, any kind of like rehab, they need to search for a comprehensive treatment plan, which the goal for me success is long-term lasting, and the treatment has to fit the patient. The patient cannot be fit into the treatment. And just thinking about those 3 concepts, I think that's the way to go.
I think my takeaway message is that every patient is different. Every patient's goals and desires are different. And what patients need to avoid is getting pigeonholed into certain types of treatment. And patients need to be very aware that there's a multitude of solutions out there. And patients need to be wary, and they need to educate themselves, unfortunately in this world, on all the pros and cons of every solution, and try to research as much as they can about all those topics. As we just witnessed, we were just talking about FP1 versus FP3, and dentistry is very subjective. And then you throw that subjectivity on top of every case being biologically different. Everybody's got different bone thickness, gum thickness, bites, different, what we call the biotypes, how many teeth they got remaining in their mouth. So, long story short, patients just really need to be like their own advocates and do their own research and seek out multiple opinions, get perspectives from prosthodontists, get perspectives from surgeons, and in the end, go to an office where they are being presented different options and they are not being pigeonholed in certain types of treatment. Because unfortunately, we're going to run into places that do nothing but all on 4, or nothing but snap-on dentures, or nothing but FP1s, or nothing but crowns and veneers, right? And I feel that kind of going back to the main message of this whole conversation is that prosthodontists are highly trained in all these fields and can tell you about the pros and cons of each solution. So
I'll just add one thing real quick at the end. I think one more important thing that I just want to add is that patients need to understand that this is a terminal treatment. This is the end of the line when the teeth are going away. So you're actually you're digging a hole in the ground and building your foundation. You never want to build a home and never think about having to redo that process again. So I think that's why it's important to research and make sure you're getting the best option that fits you, because bone is a commodity, and we've had a lot of situations where we have to redo it, but then you're strapped because you don't have enough bone to actually treat the patient in the best way possible. Right. And redoing these cases is essentially equivalent to rebuilding a house from scratch, right? You're going to have to pull out all the implants, redo them, and with the thin bone that you're left with.
Right. And sometimes some patients have the confusion or just thought process that basically this procedure is going to be just as easy as the first time, and sometimes it's 3, 4, or 5 times harder. And so associated with that, they can see a higher cost associated with than a normal all-on-4 pricing. But